Friends, on this video we will cover the vascular supply described in Dr. Walker's book on page 193 and also 205. So starting out here at the division of the aorta, this would be the common iliac artery, internal iliac artery, external iliac artery, coming down to the area of the inguinal ligament, which we don't see on this model, but the inguinal ligament would cross over the body about here. And so we could say that this would be common iliac, and below the inguinal ligament is the femoral artery and femoral vein. Of course, this would also be the femoral nerve. Now going to another model, carrying down from the area of the femoral artery, femoral artery and vein, femoral artery and vein, giving off the deep femoral artery here, femoral artery and vein, passing inferiorly until it reaches the adductor hiatus. Disappears from the anterior leg of the adductor hiatus and appears in the posterior leg and is now known as the popliteal artery. Popliteal artery passing inferiorly along with the popliteal vein and the tibial nerve, incidentally, passing between the two heads of the gastrocnemius, the medial and lateral head of the gastrocnemius, continuing as the popliteal artery until about this point where it divides into the anterior and posterior tibial artery. So proceeding inferiorly, this would be the posterior tibial, passing all the way down the lower leg to the medial malleolus, and you can feel the posterior tibial artery right here. You can palpate it as it passes around the posterior and inferior part of the medial malleolus. Now we'll go to the anterior tib. We said that the popliteal artery divided at about this point into the anterior and posterior tibial artery. If we go to the anterior tibial, we see it lying on the surface of the membrane between the fibula and the tibia. So here's the anterior tibial artery passing inferiorly, just anterior to the interosseous membrane, and as it passes inferiorly, it will become in the foot, the dorsalis pedis, another palpable artery. In summary, on the points on page 193, we have four palpable arteries, four pressure points that Dr. Walker described, and this is one of them, the dorsalis pedis. Another one of the four is the posterior tib. Another one of the four he describes is the popliteal artery, that is palpable. And proceeding superiorly, of course, the fourth one that we can palpate is the femoral artery.